Yes, sir. Sir, so my work is actually on the, sir, since you are working in the field of mental health, so my work is around that only, that the professionals who are actually working in the field, how do they do their work in the midst of all the stigma? And secondly, sir, how do you manage with the stressful life, with your own stressful life?
Okay.
Yes, sir. So these were the two broad ideas that I'm working on my research.
First one is?
First one is this: how do you work in the
Stigma.
midst of the stigma? Yes, sir. And if it has impacted your work in any way, like do the patients don't want to come,
Yes.
or
And second is personal stress. Yes.
yes, sir, stress and your own emotional health and well-being.
Yes. So proceed.
Yes, sir. Sir, so I want to know that if there is any effect of the stigma on the work that you do, like in the public perception, do they view you differently when you say that I am a doctor or I am a psychiatrist who takes care of who?
In West Bengal,
Yes, sir.
the stigma is not of a scaring level.
Yes, sir.
Here people feel free to consult psychiatrists. I will not say it is stigma free,
Yes,
can't
sir.
be. Even in America it is not. But
Yes, sir.
compared to other states,
Yes, sir.
I feel that Kerala and West Bengal,
Yes,
these
sir.
are two states, and maybe Maharashtra and Delhi,
Yes, sir.
where people are more or less aware that brain is an organ and people may get some illness related to that too.
Yes,
So
sir.
they don't feel so bad about consulting a psychiatrist. The second thing is introducing myself as a. I don't feel any difference because I consider it as a specialization of medicine,
Yes, sir.
and I never felt in my life any kind of inhibition in telling that I am a psychiatrist, or patients patients come very easily to me, so I don't think it is a big issue. I don't deny the existing
Yes, sir.
stigma, but it is not a major issue as general public at times feel that people must be feeling very stigmatized once they have this kind of. See, psychosis constitutes only maybe 10% of our patients.
Yes, sir.
I see migraine, I see headache, I see anxiety, I see depression, I see obsession and depression and childhood. I am basically a psychiatrist interested in child
Yes,
and
sir.
adolescent. So the issues are so many. So the psychosis constitutes only a part of it. Maybe 10%.
Okay,
And
sir.
that is the area where people really have that stigma that going to psychiatrist will be considered as going to a mad doctor or a doctor for mad,
Yes, sir.
that kind of a stigma. So that constitutes only 10% of psychiatry, and rest of the people these days don't feel much inhibited in coming to psychiatrists, at least in West Bengal.
Yes, sir.
Hmm.
Okay, sir, and you were saying that patients do come. So, sir, have you ever felt that your patients who are going through depression or anxiety, sir, they are a bit reluctant at first to come because people might say that, oh, you're having some mental problem. Are you mad or crazy? Do you feel like your patients have that reluctance?
Tell me your question again in brief.
Sir,
Actually, one way in a class, so at times I am missing few words. Tell me again your
Okay.
question in
Yes, sir.
brief.
Sir, so have you felt that the patients who come for issues such as such as depression and anxiety, sir,
Hmm.
are they reluctant to come? Like people will consider me that
Yes, I do. Yes.
I'm going to a mental.
Till,
Uh,
till it is a minor problem, they prefer going to a physician first.
yes, sir.
They prefer going to their family physician, and once they see that the thing is going beyond control and they are suffering, then they decide to come to us.
Okay, sir. And sir, so does a part of your work involve, uh, like influencing them that this is not wrong, or talking with them and saying that it's okay if you're taking help?
No, I think they have dealt with that problem before coming to us.
Okay, sir.
Once they decide they come to psychiatrists, they are free with us. I think these things are taken care of by physicians who are simply consultants, who see they convince them to go to us.
Okay, sir. Sir, and
Coming to
personally,
psychiatrist.
yes, sir. Sir, and personally, like, have you felt any time someone, like, you also mentioned the term that people are saying that I'm going to a mad doctor or something like that. So, have you personally faced any kind of issues, and how do you come to terms with it?
Yeah, I mean, sometimes people may tell that the people look down upon them, that they are going to a psychiatrist. So we deal with those issues, not that we don't deal with. We make them understand that brain is the same organ as your kidney or heart is, and the brain, one of the function of brain is mind, and you have an illness of mind. So anything which has to do with brain, you have to go to a brain doctor, and psychiatrist is nothing but a brain doctor, like a
Yes, sir.
kidney doctor or a heart doctor.
Yes, sir. Sir, actually, I also asked about the person, like your personal experience. As a doctor, have you faced that thing anytime that you are treating mad people or anything like that?
No, no, it's the most pleasant work that I do. I enjoy doing psychiatry.
Yes, sir.
Psychiatry is my passion.
Yes,
I
sir.
have, when I appeared in interview for my MD entrance, when I
Yes, sir.
entered as a student of MD, the director asked me, why do you want to come to psychiatry? I told him that somebody who is not able to understand his pain and is in need of help and doesn't know that he needs the help,
Yes, sir.
that kind of helplessness attracts me, and I feel like helping such people, and
Yes, sir.
that feeling stands true even today for me.
Okay, sir. So
Yeah,
it's your passion, sir.
yeah, it's my passion, you
Yeah.
can say. Yeah,
Okay,
I
sir.
really love doing psychiatry.
Okay, sir. So coming to the second part of my work, sir, like since I understand that constantly seeing patients of such nature who are going through situations like depression, it might be depressing for you also.
See,
Uh,
initially, maybe you get very much involved with patients in initial practice, but we, after doing 32 years in psychiatry, we are practically, it is my way of life.
yes,
I'm
sir.
quite used to, and I deal with patient one at a time, and I'm not generalizing things, and I understand that this is a problem which will go with treatment and with my counseling. So
Yes,
I
sir.
take it as a problem like any other illness. So I don't feel it to be very difficult
Yes,
to
sir.
adjust with. But the only thing that I feel is at times taxing to deal too much of workload, because psychiatry should be slightly leisurely. Means you have to have time to talk to patient. You must have your time of your own, and you pursue your own interests. So those things, I being a very busy practitioner, I lack those things which could have made my life better if I had time for myself, or I could have done the work at a leisurely pace.
Yes, sir.
Which unfortunately I am not in a position to do. So I find that to be taxing, and the amount of load that I have to take, maybe with any other medicine branch also, I would have felt the same kind of load. Maybe psychiatry is slightly more taxing because the patients are nagging. Patients have to be reassured frequently and time and again, and they keep on telling ठीक होंगे कि नहीं होंगे, बचेंगे कि नहीं बचेंगे, इस तरह
Yes,
का
sir.
that kind of means they have to be reassured time and again, so that at times gets on your nerves.
Yes, sir.
So that is little difficult. Otherwise, seeing psychiatric patient, as I told you, if the doctor is passionate about his work, it should not be a great load for him. It's rather a pleasure. I find it quite pleasant. I never felt that the work is boring for me in any way.
Yes, sir. Sir, and
Rather I find it very challenging.
okay, sir.
I deal with children's problem, which is even more challenging for me.
Yes, sir. Yes, sir. So that is your driving factor, because the work is also challenging, plus it's your passion. So it's a combination of the two.
I love reading, so I'll keep reading. I go to important seminars. I present papers, and everything put together. It's a ideal job for me. What I would have loved to do in my life.
Okay, sir. Yes, sir. Sir, and also like you mentioned that when patients are nagging, so sir, patients do they get emotional and aggressive also sometimes?
Yeah, those things are technical. When sometimes people do get aggressive, they may have come in a bad shape, in a psychotic state. So there are, because I have nursing home and I have my own clinic with many staff. So those technical aspects are taken care of them. Usually there'll be two staff escorting an aggressive patient when they come to my room. Yeah, they know that which patient could be aggressive. Sometimes once while there may be a miss, but most of the time they know which patient needs escorting, and those issues are technical issues. I think any psychiatrist will grow a sense that this patient has to be seen from a distance and all those kind of things.
Okay, sir. So, sir, is this kind of a situation also like stressful and taxing for you when they are when they are being very emotional, and when they are acting out in certain ways?
Yeah, sometimes you definitely feel with the patient, and otherwise most of the times you feel it as a routine work. Seeing a depressive patient, you hear the same kind of thing, so you get you do your job without getting involved. But sometimes it may be painful if a mother has lost her only child and is crying. So you are, after all, a human being, and you can't be very neutral and very detached from the person. So you get involved. Those things are sometimes issues with us.
Yes, sir. So in those times, like, how do you try to manage yourself when it is affecting you in some way?
And see, I sometimes I don't do anything. I usually study and practice. So study is like relaxing, and practicing is like work for me. So I make a balance. Sometimes I get fatigued. Maybe after 2 months, I always feel like taking a break when I go for a conference or sometimes holiday. family or with my college friends and all those kinds of the relaxation I need to rewind
Yes,
and
sir.
restart. So the unwind kind of thing and getting back to job in a fresh way. So those things are there, but day-to-day practice doesn't be that way.
Mm-hmm. Yes, sir.
Uh, does that satisfy you?
Yes, sir. Like I was also looking for how do you try and cope with it? How do you try and deal with it? So I think, sir, you've covered that in this
Yeah,
answer.
I do. Told you I mix it with my academics. Academics is my another passion, which is I'm more passionate about academics. So academics, morning time, some 5 to 9, I study my subject and make presentations, which I present in different places.
Yes,
So
sir.
all those things are like relaxation for me.
Mm-hmm.
And then I do exercise and I be with my pets
Yes, sir.
and sometimes with family
Yes, sir.
and I relax. So all these things I manage more or less. I manage with coping with my work stress.
Yes, sir. Sir, do you think that had like the other branches of medicine? So, do you think previously you mentioned that I consider it as a specialization of similar to another other specialization?
Medicine is a branch of medicine, so I
Yes, sir.
consider it like yes.
Yes, sir. So, sir, but do you think that the stress or the emotional toll that is there, that is more than other specialization of medicine in psychiatric work?
As I see that some literature suggests
Yes,
that
sir.
psychiatric could be slightly more stressful. Though the recent data say that it's almost at par,
Yes, sir.
but there could be literature suggesting that it could be stressful. But if you take me as a person, I don't feel that this is more stressful than any other branch for
Mm-hmm.
me, which may not be true for others. Many of my friends may find it to be more stressful,
Okay, sir.
but for me, it's okay.
Yes, sir. So, sir, like for you, you think that had it been some other specialization, the amount of stress level would be the same.
Could be less, but
But
I
sir,
love the
like
challenge of psychiatry.
yes, sir.
I love the challenge of psychiatry.
Yes, sir. Sir, but like I was of the opinion that because there's a lot of emotional involvement that goes on, I thought that maybe you have to not just balance out work-wise, but also you have to work on your emotions and your own mental well-being. So
See, I am 60
yes, sir.
plus, 60 plus.
Yes, sir.
Until date, I consider myself to be a normal person
Yes, sir.
and lead a very normal life.
Yes, sir.
So, it's, for me, it is all right.
Yes, sir.
Every person will be different. Others may find it different,
Yes, sir,
but
definitely.
I find it interesting and I love doing it. So I don't have much of a stress.
Okay, sir.
Hmm.
I think so that would cover it. I think
Yeah. So
because
in
sir,
that case,
I am
send me
finding it so interesting, and since I've been working on it like for a couple of few months, so I have questions which I can go on and on asking. But I think that would be taking too much of your time.
later
Yes,
on,
sir.
if you feel like you can talk, if you have any specific issue,
Yes, sir.
and meanwhile you can send the questions that you wanted me to send. I'll do it in a day or two.
Yes, sir. So, like, actually, I'm a scholar of management.
Hmm.
So, I am looking at it from the management perspective. and
Right.
particularly my area is organization behavior, and so it involves the personality and everything. So at the individual level, so my work is like that only. I'm looking at how people deal with stigma, especially in this kind of work, which is
Mhm.
emotionally taxing. So, I mean, I am studying from a management perspective.
See, well, I'll have one suggestion to you.
Yes, sir.
Usually when people start studying such topics,
Yes, sir.
they have a bias that this must be very stigmatizing. The
Yes, sir.
doctor must be very stressed out, and the doctors must be finding it difficult to settle with emotional issues.
Yes, sir.
Uh, these are the inherent biases of this subject.
Yes, sir.
We believe that politician must be corrupt,
Correct. Yes,
politician
sir.
must be dishonest, politician must be cheating people. That kind of we start with biases,
Yes,
isn't
sir.
it? Which excludes people many people who could be like Manmohan Singh, who is not dishonest, who is not meant. There could be exceptions,
Yes, sir.
and so I like you to work with and with open mind.
Open mind. Yes, sir.
Open mind. You should really find out the truth,
Yes, sir.
which I like to do whenever I do such work or research work, or so that way the impression that I gave you is slightly on positive side
Yes,
rather
sir.
than negative, which is my true reflection of my mind. I'm not telling you to boast in any way that I am different or I'm a great
Yes, sir.
person and the others are not so great. And I don't mean that. I really love doing this, and I do lot of things. I work with children. I work with education of children, nutrition of children. I work with. I have nursing home. I have rehabilitation centers.
Yes,
So
sir.
many things. I look after different aspects of psychiatry, and I try to serve in different manners, which may not be directly psychiatry. Like I
Okay, sir.
do, like I take up students, the poor students of my village, my ancestral place, where I run coaching classes, free coaching classes
Yes, sir.
for the poor. I have many teachers appointed who look after their education, so that it is like preventive psychiatry. Like children should get good education, good nutrition,
Yes, sir.
and they don't fall prey to the different social difficulties that cause psychiatric illness. So all those issues, I try to make it as comprehensive as possible.
Mm-hmm. Yes,
Uh,
sir.
just to tell you, not boasting about me,
No, sir. Yes.
just tell
Please,
you
please,
that
sir.
I am the president-elect of Indian Association of Child and Adolescent Psychiatry
Yes, sir.
for the year 21 to 23.
Yes,
I'll
sir.
be president of Indian Association of Child and Adolescent Psychiatry. So
Okay, sir.
I look at the subject with the whole comprehensiveness of a bigger view of
Yes,
the
sir.
thing. So and that is one of the reasons that you can feel that this man is talking slightly with more positive overtone than many others.
No, no, sir, definitely not. Means whatever you have said, your inputs, your insights are like, it's adding great value. Like
Yeah,
it's adding a
actually,
new dimension. Yes, sir.
it is actually real feelings that I am conveying to you, so
Yes,
that
sir.
you get the total picture. Total picture. You don't stay biased with your own presupposed ideas.
Yes, sir.
You must get a total idea of how psychiatrists of different kind may feel differently about society and patients and psychiatry in general.
Yes, sir.
Is that fine?
Yes, sir. That would,
Okay, then.
that's more than enough, sir. Yes, sir.
Okay.
Sir,
Good
I'm
night, then.
really thankful for your time. Sir, actually,
Most welcome.
I am based in Rohtak, so I'm studying there.
Mhm.
But like mine is a residential course, but my hometown is in Asansol.
Mhm.
So I was here for a week or so, but now,
Yeah.
sir, and I wanted to come and meet you personally.
Most
So
welcome. If anytime you feel like you
yes,
can
sir.
come. If you
Sir,
want
actually,
to,
because of the coronavirus scare, now I could not come this week, and now I have to go back to Delhi to Rohtak.
okay.
So, but
Any
I
other time, if you feel like, if you have holiday and you want to pass 2-3 days with us in our hospital, sitting beside me and seeing patients, how psychiatric patients look like, and
yes,
how
sir.
we deal with them, you are most welcome. We have been doing this kind of work many a time. In fact, management students came from Chennai all the way
Mhm.
in a big group. You can check in our mental health care center in Facebook, and then mental health care center. You can search with my name also.
Yes, sir.
You'll find some data there, and then there is a institute of uh, social work in Durgapur.
Yes, sir.
Their students come to us in groups, work with us for 1 month, seeing patients. So all those things we carry at our center.
Mhm.
So anytime, if you have time, you want to pass 2-3 days or a week, you are most welcome.
Yes, sir. Definitely, sir. Like I'm just delighted to hear you offer me this opportunity because it's a huge opportunity for me. Yes, sir.
So anytime, so that will give you a true impression of psychiatry.
Yes, sir.
And then you will know that psychiatry is like any other branch.
Yes, sir.
These are the people with difficulties. The only difference with other patients is that the difficulty is in brain and not in the other organ.
Yes, sir.
And mind is just a function of brain.
Yes, sir.
Right. Okay. Good
Thank
night.
you so much for your time, sir. Hello? Hello?
Yes.
Yeah, yes,
Okay.
sir.
Good night.
Thank you so much for your time,
Okay.
sir. And I would definitely correspond with you, sir. I would definitely keep in touch with you, sir.
Okay. Most welcome.
Yes.
Bye.
Thank you so much,
Bye.
sir. Yeah.
Okay. Bye.